Welcome back to Hannity. So earlier today, President Trump met with members of the Republican Study Committee, where he said some changes were made to the GOP Obamacare replacement plan, and that all representatives at the meeting said they were now planning to support the legislation. Watch this.
All of these no's, or potential no's, are all yeses. Every single person sitting in this room is now a yes. And we made certain changes, and very frankly little, although the block grant is very important, because I want the states to get the money and to run the program if they want to run it, because they can do it better than the federal government. They're better equipped than the federal government. I also want people to know that Obamacare is dead. It's a dead health care plan. It's not even a health care plan, frankly. Only because everyone knows it's on its last dying feet. The fake news is trying to say good things about it, okay? The fake media. And there is no good news about Obamacare. Obamacare is dead.
All right, joining us now with reaction, two representatives who were in that meeting today. Tennessee Congresswoman Marsha Blackburn and Majority Whip Louisiana Congressman Steve Scalise is with us. Congresswoman, I'll start with you. And
sure.
Look, the Republican Study Group is a conservative group within the Congress, but it's not as conservative as, say, the Freedom Caucus. Their members tell me today they're still not on board, although they are some of the changes that I saw today that, you know, they're pretty happy with. You know, in addition to the Medicaid agreement with the study group, et cetera, that they're going to impose the states the option to impose work requirements, and also that they, you know, other new wording. These were all things that I know that the Freedom Caucus wanted. How close do you think we are to getting them on board, too?
I think we're very close, Sean. This is a bill that's moving the right direction. And today, the Vice President and President asked us to work with them, which, you know, we've been working with Whip Scalise. We have been working with the White House, and they've asked for our support on this. And I think it's important for Republicans to have a win. As you've said, this has taken longer than it should have taken. We need to continue to work on the Medicaid expansion, address those issues, and make certain that this is a bill that Republicans can support and send to the Senate for them to take up the House bill.
Yeah. Steve, where are you with the Freedom Caucus guys? Because they've been the ones that have communicated with me the most, that they say the president, A++. He's been reaching out to them, talking to them. They appreciate it. The president's listening. Some changes they wanted are in the bill, but they feel the leadership has not reached out as much to them. Why?
I've been talking to Freedom Caucus members directly, Sean. In fact, today at the meeting with the RSC chairman, Mark Walker, and other RSC members, there were two Freedom Caucus members there who said they're going to vote for the bill, which included one member, Gary Palmer, who had voted against the bill in the Budget Committee yesterday. So with these changes, you talk about something revolutionary, block granting Medicaid, giving governors complete ability to block grant the Medicaid program. That's a revolutionary reform conservatives have been wanting for decades. That's now agreed to by the president, and that'll be in the bill. And the work requirements, where
those are two things that they
option.
told me. Those are two things specifically that Mark Meadows and Jim Jordan told me that they wanted in the bill. Can we?
Right.
Is
those
there
are big wins, and that's what brought some of the Freedom Caucus members that were in the room today to say they're now for the bill. So this, like Marsha said, this bill's moving in the right direction, and members are engaged. But what's most important, Sean, the president is directly engaged. President Trump said, I am behind this bill 100%. He wants this bill on his desk to repeal and replace Obamacare and put patients back in charge
by the end of next week.
So his help is a lot. Yeah, his help has been tremendous,
Marsha,
and he's rolled up his sleeves and gotten to work on this directly.
Yes.
Is there anything to learn from this? In other words, should consensus have been built before the bill instead of this public fight and intramural squabbling, civil war? Because from my perspective, you cannot not do this. We're at the point, this is the president's first major signature legislation here. And it seems that it was maybe you wrote the contract before the deal points were made. It seemed like you got the cart ahead of the horse a little bit. Do you think it could have been handled differently,
yes.
better?
I do. You know, one of the things Republicans don't take the time to do is establish the predicate. And Republicans should have started talking about why we have to repeal and what we're doing to put patient-centered health care in place. We should have been doing that coming November 9th.
Right.
And then leading up to this, building out that big picture, and then working more closely, conservatives, us House conservatives, with the leadership and, of course, with the White House. The President and Vice President have been terrific. They've said, tell us what we need to do. We're
right, working on
this. Let's solve it. Yes.
And the Congressman, you think you're going to have the requisite number. Are you working hand in hand with the Senate? Is the Senate bill going to be much different? And when you get the House and Senate together in conference, are you confident that this is all going to get done?
Yeah, I think most senators like the direction
losing
we're
is
going.
not an option here. Yeah.
That's right.
Failure is not an option. But look at this, Sean, something else that just got included, that today brought National Right to Life to write a letter of strong support of this bill. This will probably be one of the most pro-life pieces of legislation with the high protections and defunding
Absolutely.
Planned Parenthood. That's a big win, too, for conservatives.
That's a big win.
So that's
they
also
are
in the
enormous
bill.
wins. They think those are things that we have wanted to see happen, and I think the Senate is going to be
there are a lot of
ready
good things
to
in
take
there. I
our
agree.
bill up. Yeah, they're going
All
to be
right, guys.
ready to take it up. Thanks.
All right.